chapter, we are going to learn about health and disease, types of disease, and the mode of infection, symptoms, and prevention. Can you recall his questions to you? Have you ever taken the leave from school due to sickness? Yes. What happens exactly when we become sick? Answer: not feeling well. Some symptoms are seen, then we visit to the doctor. Doctor asks some questions to us and we replied. What we replied, that are the symptoms that is seen in our body. Sometimes we feel good even without taking any medicine, and sometimes we need to consult doctor and take regular medicine in sickness. Why is it so? Sometimes symptoms are not dangerous, but sometimes symptoms are dangerous. That's why we must visit the doctor and take regular medicine in sickness. Now, how we can define the health? Yeah, what do you mean by health? Now, health is a state of complete physical, mental, and social well-beingness, and not absence of any disease. It is a state of human body which completely physical in good condition, mentally good condition, even social well-beingness is also, and not only absence of any disease. Now, what is disease? Now, disease is also condition in human body of disturbance in psychological, physiological process of body is called a disease. Means there is a condition in human body, the function of body is psychological disturbed and physiological is also disturbed, that is called the disease. Now, each disease has its own specific symptoms. Symptoms, that is, for example, fever, nausea, vomiting, these are generally called as symptoms. Now let's learn the types of disease. You must have here the names of various diseases like diabetes, common cold, asthma, Down syndrome, heart disease, etc. Reasons and symptoms of all these diseases are different. Different diseases have different symptoms. To bring coordination in scientific study of disease classify as follows. Now observe the chart very carefully. Now types of disease. First, according to duration, means the disease is last for how many hours, days or years. Now second one, according to reason. Now according to duration, disease classify into the chronic disease and acute disease. According to reason, it is classified into hereditary disease. For example, Down's syndrome means disease generally transmit from parents to their offspring. Acquired disease, it is classified into infectious disease. For example, common cold, flu and dengue. Infectious disease means generally transmit from one person to another one. Non-infection disease, for example, diabetes and heart disease, means generally it is not transmit from one person to another one. Observe the diagram. Infection through sputum, that is spill. How do you the following disease spread? Hepatitis, malaria, scabies, tuberculosis, dengue, dysentery, ringworm, swine flu. All this is spread through their pathogens. Pathogen means the microorganism which causes disease. Some disease spread by different mode. What do we mean by pathogen? Now, pathogen is a microorganism which causes disease in the human body. What do we mean by infectious disease? Infection disease means by the disease spread easily from one person to another one. Now in this picture, the person when speak or talk, small particles that is called droplet are vaporized into the air. So these droplets remains in the air for several minutes or to few hours. Large droplets settle on the ground with a few seconds. A healthy person comes in contact with that area, that person is also gets affected. Now let's learn very detail, that is infectious disease. Disease spread through contaminated air, water, food or vectors, means insect and other animals are called infectious disease. Remember that disease spread through contaminated air, it is polluted air. Water, contaminated water means not clean water, that is dirty water. Or contaminated food, and some insect like mosquito, rabbit, yeah, mice. These animals are, means if they bite us, affected dog is bite us, then we get disease. So that disease is called as infectious disease. Now observe the first column, there are names of disease. In second column, pathogen, that is name of microorganism that cause disease. In third column, mode of infection, how the disease is spread. Symptoms, that is mostly observed in the body. And the last column, that is prevention and treatment. Now observe the first one, tuberculosis. It is also short form TB. Now tuberculosis is caused by the Mycobacterium tuberculei. So this is name of pathogen. Now tuberculosis is mostly infected by spitting by patient. Means patient is spit on the ground, on floor, through the air also, prolonged contact with and sharing of materials of patient. So this is the mode of infection of tuberculosis. Now which symptoms are observed in the tuberculosis patient or the patient which is affected by the TB? Chronic cough is a prolonged cough. Bloody spitting, that is sometimes blood comes out through the body. It's a difficulty in breathing. Now the prevention and treatment against TB, that is BCG vaccination. Isolation of patient, means patients are insist only living in a single room. Regular medications like DOT, direct observed treatment centers, tablets are provided to the TB patients. Now hepatitis. Hepatitis is caused by the virus like hepatitis virus A, hepatitis virus B, hepatitis virus C, hepatitis virus D, hepatitis virus E. Now this disease is spread by contaminated water, sharing of needles and blood transfusion. Sometimes when before blood donation we must check the blood. Blood transfusion is also mode of infection of hepatitis. Now symptoms, anorexia, that is feeling lack of hungry, yellow urine, general weakness, nausea, vomiting and grey stool. These are the hepatitis symptoms. Now, hepatitis is prevented by the drinking boiled water, proper cleaning of hands. These are the precautions. If we take, then we can avoid the hepatitis disease. Now, third one is dysentery. Dysentery is caused by the bacteria, virus, Shigella, bacilli, entamoeba histolica. These are the name of microorganism. These microorganisms mostly found in the contaminated food and water. If we drink such type of the contaminated water or we eat contaminated food, then we get dysentery. Now, major symptoms of dysentery is watery stools and pains in abdomen. Now, it is very easy to prevent the dysentery, that is by drinking of boiled water, proper storage of food, ORS consumption, that is oral rehydration solution consumption. Now, fourth one is cholera. Vibrio cholerae is a name of pathogen which causes the cholera. Now, it is also spread by the contaminated food and water. Symptoms same, that is vomiting, severe diarrhea and cramps in legs. Now, cholera is also prevented by using a hygienic practices like avoiding open food, drinking boiled water, vaccination against cholera. Now, typhoid. Typhoid is caused by the Salmonella typhi. This is name of bacteria which cause typhoid condition in human body. Now, it is also spread by the contaminated food and water. Now, symptoms of typhoid are anorexia, headache, rash on abdomen, dysentery and fever up to 104 degree Fahrenheit. High temperature mostly observed in typhoid condition in human body. Now, typhoid is also prevented by the using good practices like drinking a clean water, vaccination, proper disposal of sewage. So, student, remember the name of disease and name of pathogen, as well how they spread, that is mode of infection, and which symptoms are observed of particular disease in human body, and the last, that is prevention and treatment.